Hey guys, I'm Dr. Kenny, and for those of you who don't know me, I'm an internal medicine physician from California. So I took care of this interesting patient in the last few weeks, and I learned something that I really wanted to share with you all. Since you saw the title, hopefully you're interested in the topic, but I'm going to be talking about my medical experience with vaping in this video. So my patient is a 23-year-old, and she'd been having about 4 days of difficulty breathing. She'd also been having a lot of cough, producing a lot of mucus, and she'd been having fevers. She really couldn't breathe, and so that's why she came to see us in the emergency room. At that point, the emergency doctors didn't know what was going on, so that's why they started to investigate. They did a CT scan of her chest and found that there was severe lung disease. She was 23 years old, and her lungs looked like they could have been 60 or 70 years old. At this point, we had no idea why. We asked her, does lung disease run in your family? Do your parents have lung cancer? Do you have toxic exposure or hazards at work, like maybe asbestos or mold or lead or anything like that? And all of her answers were no. We asked her, do you smoke? And again, her answer was no. And we specifically asked, do you use any kind of recreational drugs like marijuana, cocaine, meth? And she said no. So throughout her hospital course, we tried to figure out what was going on. We scanned her chest with x-rays and CT scans. We got blood tests looking for infections and autoimmune diseases. We tried antibiotics, we tried breathing treatments, we tried steroids. We did a bronchoscopy, which basically means we used the camera to dive into and look at the inside of her lungs and take samples. We even called the lung surgeons to come and see her for a lung biopsy, which is a surgical procedure where they go in and cut and take a piece of your lung for analysis. Luckily, it didn't get to the point where she needed surgery, and she slowly started to turn around and get better with tons and tons of steroids. But you can only imagine how afraid she and her family were. So here's where the story gets interesting. And this actually happened way earlier in the hospital course than I'm making it sound. But I say this because we had lung doctors and infectious disease doctors and lung surgeons all on this case. We had all these doctors putting their brains together, and essentially we ruled out every lung disease that we can think of, but she just didn't test positive for any disease, and she just didn't fit the picture. But at one point we asked her again, do you smoke or have you ever smoked before? And her answer was no. Then we asked her, do you vape or do you use e-cigarettes? And her answer was yes. And she said the reason she never mentioned it before was because she thought it was safe, and she was told that these pens cleaned out the smoke for her. Guys, look, I'm not blaming her for anything. She was a sweet girl, she was a good patient, just minding her own business. But today, vapes and e-cigarettes are accessible to even middle schoolers, so that means they must be safe, right? So honestly, I don't know what the death count is right this second. The last time I checked, there have been 6 reported cases of deaths possibly linked to vaping, but it doesn't really matter because the number is constantly changing, and they're saying it's possibly related to vapes, so nothing is confirmed quite yet. I can't answer any of these questions, but there's one thing I want to emphasize, and it's the reason why I made this video, is that you gotta tell your doctor if you're vaping. So after I took care of this patient, I went and did a little mini experiment. I interviewed my friends, and what I found was that almost half of them didn't disclose to me that they were using vapes or e-cigarettes when I asked them, do you smoke? Some of them told me the reason why was because they weren't sure how vaping affected their health, that there wasn't enough research proving that it was dangerous, and that since kids were using it, maybe it wasn't as dangerous as smoking. So we talk a lot about building healthy habits on this channel, but I want to encourage you guys getting in the habit of telling your doctor if you do vape and telling your doctor what you put in your body. As always, guys, I'm here to help. Ask questions, leave comments below. If you want to send us more personal questions, you can go ahead and add us on Instagram and send us a message that way. Subscribe for more videos and if you want to support us, and most importantly, give this video a thumbs up and share it with people you know who vape to help us spread this little message. Thanks again for watching, guys.